Welcome to Have More Babies. Today, we're diving into something called quinsy. It might sound a bit alarming, maybe, but it's really important for parents to know about. We've probably all dealt with tonsillitis, right?
Oh, definitely. Seems like a rite of passage sometimes.
Exactly. So quinsy is a less common, but yeah, potentially serious complication of that. We've been looking at some great information from Omega Pediatrics to really get clear on it.
Yeah, their resources are excellent.
We want to unpack what quinsy actually is, those early signs to watch for, and crucially, what the plan is if it happens.
Right. So quinsy, you might also hear it called a peritonsillar abscess.
Peritonsillar abscess, okay.
Yeah, and it's basically a collection, like a pocket of pus, that forms in the tissue right beside a tonsil.
So not on the tonsil itself, but next to it.
Exactly, in that little space between the tonsil and the wall of the throat, the peritonsillar space.
Got it.
It's more than just tonsillitis getting worse. It's a separate, localized infection setting up shop there.
And you mentioned it's a complication. Is it common?
Thankfully, no, it's not super common, but it is severe when it happens. We tend to see it more in older kids, adolescents, young adults, but technically anyone can get it.
It's okay. And the seriousness comes from?
The main risks are potential airway obstruction, trouble breathing, basically, and the infection possibly spreading deeper into the neck.
Okay, so definitely something you want to catch early. What are those first, maybe subtle signs that this isn't just standard tonsillitis?
That early spotting is really vital. A key thing is often a severe sore throat, and frequently it's much, much worse on just one side.
One side specifically?
Yeah, that's a big flag. Also, difficulty swallowing. Sometimes it's really painful just to swallow saliva.
Ouch.
And you'll often get fever and chills along with it. Pretty standard infection signs, but combined with that intense one-sided throat pain.
Right. Those things together start painting a different picture. Now, Omega Pediatrics mentioned something called a hot potato voice. What exactly does that sound like?
Hey, it's a very descriptive term, isn't it? It means the voice sounds muffled, maybe kind of gargled or distorted.
I see.
It's like the person's trying to talk with, well, a hot potato in their mouth. The swelling from the abscess physically changes how sound comes out.
Makes sense. Anything else?
You might also notice or feel swollen lymph nodes in the neck, usually on the same side as the worst pain. Again, the body reacting to that infection.
So recognizing these signs quickly is paramount then.
Absolutely crucial, because quinsy can, develop pretty fast.
And the information from Omega Pediatrics really stressed not just waiting this one out at home.
Definitely not. The risk of that airway getting compromised even slightly is just too significant. If breathing becomes difficult, it's an emergency.
So if a parent sees that really bad one-sided sore throat, the swallowing difficulty, maybe the voice change, fever, what's the immediate next step?
Get medical attention right away. Call your doctor, go to an urgent care, or even the ER depending on severity, especially if there's any hint of breathing trouble.
And what will the doctors do to confirm it's quinsy?
They'll do a careful physical exam, look inside the throat. Sometimes the diagnosis is clear just from looking, but they might also need imaging, like a CT scan or maybe an ultrasound of the neck to see the abscess clearly.
Okay, so diagnosis confirmed. What does treatment look like? Is it just antibiotics?
Antibiotics are definitely part of it, but usually you need to drain the pus first.
Drain it. How?
There are a couple of main ways. One is needle aspiration, using a needle and syringe to carefully draw out the pus.
Okay.
Another is incision and drainage, where they make a very small cut over the abscess to let the pus drain out.
Right. And sometimes tonsil removal.
Yeah, a tonsillectomy might be considered, especially if someone gets quinsy more than once, or if it's particularly severe. It removes the site where these tend to form.
And the medications, you mentioned antibiotics.
Yes, antibiotics are key to clear the underlying bacterial infection that caused the quinsy in the first place.
Yeah.
Things like penicillin or amoxicillin are common choices. And, of course, managing the pain is important, too. Over-the-counter pain relief can help make the patient more comfortable while everything else is working.
Makes sense. Now, thinking preventatively, since it stems from tonsillitis, is there anything Omega Pediatrics suggests to lower the risk?
Well, yeah, the best way to prevent quinsy is really to prevent or effectively treat tonsillitis.
So good hygiene.
Good general oral hygiene, yes. And for kids who get sore throats a lot, especially bacterial ones like strep, sometimes doctors recommend regular throat swabs.
To catch things early.
Exactly. Catching and treating bacterial tonsillitis promptly with antibiotics can stop it from progressing to something like quinsy. So again, seeking that medical advice quickly for bad sore throats is key.
This is all so helpful. It's definitely one of those conditions you hope you never face as a parent.
Absolutely.
But knowing what to look for, knowing it needs quick action, that feels empowering, doesn't it?
It really does. Understanding quinsy means you're equipped. Early detection really does make it a manageable condition, even though it sounds scary initially. Being informed helps you act fast for your child's health.
And for anyone listening who wants to read more about this or just explore other child health topics, Omega Pediatrics has a lot more information on their website.
Definitely check that out. It's omegapediatrics.com.
So wrapping up, Quincy, serious, yes, but thankfully uncommon. A complication of tonsillitis.
Right. Key takeaways are those signs that really bad, often one-sided sore throat, trouble swallowing, the fever, that muffled hot potato voice.
And the big message, don't wait, seek medical help fast.
Exactly. With prompt diagnosis and the right treatment, like drainage and antibiotics, it's very treatable.
It really makes you think, doesn't it? Knowing about these less common but serious possibilities, how does having this kind of information maybe change how you view the next just a sore throat your child gets? Something to consider.
It's good food for thought.
Thank you so much for breaking that down for us. And again, for much more detail, please visit omegapediatrics.com.
Yes, please do. And if you found this helpful, we'd really appreciate it if you'd like this video, subscribe to the channel for more insights, and maybe share it with other parents or caregivers who could use this information.
Thanks for joining us on Have More Babies.
Goodbye, everyone.